You've probably been there, or maybe someone you know has. That waiting room in a hospital emergency unit, the ER, or casualty as some call it, the air feels thick with worry, right? And the waiting, it just feels endless sometimes.
It really does. It's an incredibly stressful place to be.
And then you see it happen. Someone who, well, just walked in gets taken back for treatment, while you, or maybe your loved one, you're still just sitting there. It feels, I don't know, confusing.
Yeah, confusing. Maybe even unfair sometimes. It definitely ramps up the anxiety when you're already worried.
Absolutely. Which brings us right to the core question we want to tackle in this deep dive. When lots of people show up needing urgent help, how do the staff actually decide, who gets seen first? What's the system?
Right. And there is a system. It might seem chaotic from the outside, but behind the scenes, there's a crucial process called triage. It's pronounced triage.
Triage. Okay.
That's the system that guides those decisions.
Okay.
It's all about prioritizing patients.
Okay, so let's really unpack this. Our mission today is to understand triage, the system behind who gets seen first in the ER. We want to figure out why it's necessary, how it actually works, and maybe most importantly, what knowing all this means for you if you ever find yourself in that waiting room situation.
Exactly. Whether you're the patient or you're there supporting someone, we've gathered some info that explains this and also looks at the bigger picture of how healthcare systems try to ensure quality care.
Great. So before we dive deep into triage itself, maybe let's just quickly set the scene. What is an emergency unit, really?
Good idea. So the casualty unit, ER, it's specifically designed for immediate critical care. It's for life-threatening stuff or really urgent medical problems that need attention now.
Right. Not your scheduled checkup.
Definitely not. Think severe injuries, sudden intense pain, major symptoms of illness.
And unlike a clinic, people arrive, well, whenever, often many at the same time, and with totally different levels of need.
Precisely. And our sources point out that these units, especially in big hospitals, can get crowded really fast. Lots of people arriving at once.
Which right away makes it obvious why just lining up, first come, first served wouldn't really work. Not if the goal is helping the sickest people first.
Exactly. It wouldn't be effective for providing the best care to those who need it most urgently.
That definitely sets the stage for why triage isn't just like a nice idea, but something they absolutely have to do.
It's essential.
So let's get into it. What is triage fundamentally? How does it work?
Okay. At its core, triage is a medical system for sorting patients. But the key thing is it ranks them based purely on how severe their condition is.
Not when they arrive.
Not when they arrive. That's the critical difference.
So the whole philosophy isn't about being fair with waiting time. It's focused somewhere else.
Exactly. The absolute main goal, and the sources really emphasize this, is saving the most lives and preventing the worst outcomes by making sure those with the most critical needs get attention immediately. There's a quote from one source that sums it up really well. Triage is not unfair. It's focused on saving lives fast.
Huh. Saving lives fast.
That really changes how you might see it, doesn't it?
It totally reframes it. It moves you from thinking about your personal weight to understanding it's a system designed for the most critical needs overall.
And this triage system, it's pretty standard practice.
Oh, yeah. It's used in emergency units basically everywhere, globally, including, as one source mentioned, widely used across India, for example.
Okay, so walk me through it. Let's say I arrive at the ER. What happens? How does the triage process actually unfold step by step?
Right. So usually pretty much as soon as you check in, or if you're brought in by ambulance, a nurse or another trained medical professional does what's called a rapid assessment.
Okay, rapid assessment.
Yeah, they're quickly looking you over, trying to figure out how serious things are right now. They'll check vital signs, pulse, breathing, maybe blood pressure. They'll assess your consciousness, how much pain you're in, the type of injury, any major bleeding, that sort of thing. Is that the quick check-in you often see near the entrance?
Often, yes, in a dedicated triage area.
Yeah.
And based on that quick look, they assign a priority level.
Ah, the level.
Right. Sometimes it's a category name, sometimes it's a color code. This is the key decision point about urgency.
And once you have that level or color, what's next?
Well, that dictates everything. Where you go, how quickly you're seen, that's the resource allocation part.
Resource allocation.
Patients with the highest priority, say red, they get moved straight to critical care areas. Those with lower priority might go to a different waiting space, or maybe an observation area.
But what if things change? Like, what if someone's waiting and they suddenly get much worse? Is that first assessment it?
No, and that's really crucial. Triage isn't just a one-off check. Patients who are waiting should be reevaluated,
Okay.
either periodically or definitely if their symptoms change or seem to be getting worse. This makes sure their priority level stays accurate.
That's good to know.
Yeah.
So let's talk about those levels. You mentioned color codes sometimes. What do they generally mean?
Yeah, the color-coded system is pretty common. It usually breaks down something like this.
Okay.
Red. That means immediate or critical. These are the patients in immediate danger. Life-threatening situations.
Like what?
Think active heart attack, a stroke, major trauma from an accident, someone who's unconscious, severe bleeding that won't stop, or someone really struggling to breathe.
Got it.
These patients essentially bypass the queue. They need treatment right now.
Makes sense. What's next?
Then you usually have yellow. That's urgent. The condition is serious, needs attention soon, but it's not immediately life-threatening at that exact moment.
Okay, so serious, but maybe stable for a short while.
Kind of. Examples might be, say, a really high fever in an older person, a broken bone that's significant but stable, or a severe pain that needs managing quickly but isn't putting their life in immediate danger. They're seen after the red patients.
Right.
Then comes green, non-urgent, minor injuries or illnesses, things where there isn't an immediate risk of getting critically worse.
So like a sprained ankle, mild headache.
Exactly. Simple sprains, minor cuts that might need stitches but aren't bleeding heavily, maybe a low-grade fever, or chronic pain that's flared up but isn't an emergency. These patients, well, they will likely have the longest wait. Sometimes they might even get referred elsewhere, like an urgent care clinic.
Okay, red, yellow, green, is that all?
There's one more, typically black. This stands for dead, or sometimes expectant.
Ooh.
Yep. Thankfully, this isn't common in day-to-day ER operations, but it's part of the full triage system, especially for mass casualty events like a disaster where resources are totally overwhelmed.
Right, when choices are incredibly stark.
Exactly. It's for patients with no signs of life or injuries so severe that survival is considered impossible or highly unlikely given the available resources at that moment. They might only receive comfort care or palliative care.
Wow, that really puts it into perspective.
It does.
So going back to my earlier example, if I show up with a sprained ankle, probably green, and 10 minutes later someone rushes in clutching their chest, short of breath, likely red, they will be seen first.
Absolutely. Without question.
It's not personal. It's not about who was there longer. It's the system prioritizing the potential heart attack over the sprain.
Precisely. And understanding those categories and the whole saving lives first philosophy, that's really key to managing your own feelings. The understandable frustration when you see that happening. It's about need, not the clock.
This really highlights how critical it is for the triage process itself to be accurate and, well, efficient.
Oh, it's incredibly important. For everyone. Accurate triage makes sure patients get the right level of care when they need it. But it's also fundamental for the hospital just to function.
How does it affect the hospital side of things?
Well, think about resources. ERs have limited staff, limited beds, limited equipment, right?
Sure.
Triage helps allocate those resources efficiently.
Yeah.
To the patients whose lives depend on it most urgently. And that directly leads to better patient outcomes. Getting the right treatment quickly for critical conditions can make a huge difference in survival and recovery.
And what about the waiting for the less urgent folks, the greens? Does it help them at all?
Well, it doesn't make the wait disappear, obviously. But good triage helps manage the overall flow. By identifying and moving the critical patients quickly, it stops the whole system from grinding to a halt, which, counterintuitively, can actually help reduce the total wait times for lower categories compared to just a free-for-all.
Ah, interesting.
And it also helps the hospital plan staffing. Knowing the number and severity or acuity of patients helps them adjust how many doctors and nurses they need on shift.
So triage isn't just this isolated thing the nurse does at the front desk. It kind of depends on the whole hospital system running smoothly behind it.
Exactly. A hospital's ability to do triage well relies on this whole ecosystem of quality standards and just basic operational effectiveness.
Ecosystem, what do you mean?
Well, you have these larger organizations that set standards. Like internationally, there's the Joint Commission International, JCI.
JCI, yeah, I think I've heard of them. They're focused on healthcare quality, patient safety, that kind of thing, globally.
That's right. Our sources point to them as a global leader. They operate in over 70 countries, accrediting hospitals and health programs. Their whole mission is about promoting and recognizing the highest standards for quality and patient safety.
How do they do that?
They develop these really rigorous international standards. They also have specific initiatives, like the International Patient Safety Goals, which focus on areas where things often go wrong in healthcare.
And then countries often have their own national bodies, too.
They do. Like in India, the source mentioned the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
NABH. Yep.
Yeah, it's part of the Quality Council of India, and it sets up accreditation programs and benchmarks specifically for India's healthcare sector. Again, the goal is building this ecosystem for quality.
So how does having these standards from JCI or NABH actually connect back to the nurse doing triage in the ER?
Well, when a hospital decides to go for accreditation from JCI or NABH, they're basically committing to meeting these high standards.
Yeah.
And that means they have to develop and consistently follow robust, standardized procedures for all sorts of things, including patient safety and how care is delivered. Having a clear, well-documented, and consistently used triage protocol is a fundamental part of that. It forces them to have reliable systems in place.
And I guess there are companies that help hospitals actually do that, meet the standards.
Yes, exactly. Consultancies like Supremedic, which was mentioned in our source material, they help hospitals prepare for these accreditations.
Yeah.
But they also help with the sort of foundational stuff.
Like what?
Like overall operations planning, making sure the physical infrastructure works, functional treatment rooms, reliable medical gas pipelines, the right equipment. They also help with getting the right equipment, maybe most importantly, staffing.
Staffing seems key.
Absolutely. Recruitment, manpower planning, making sure there are enough trained people to actually perform the triage, make the assessments, and provide the care afterwards. You need all these operational pieces working smoothly for the triage system to actually function effectively on the ground.
It really paints a picture. The efficiency or sometimes the delays you experience aren't just random. They're part of this much larger, pretty complex system that's trying to deliver quality care, often under intense pressure.
It's all interconnected, yeah. Good emergency care needs good triage. But good triage needs the hospital to have the right staff, the right setup, and solid procedures, often driven by these broader quality goals.
Okay, let's shift back to the listener's perspective again. If you are the person in that waiting room, patient or supporter, what can you actually do to help things go smoothly, or at least feel a bit more empowered?
Yeah, that's important. The sources had some good practical advice here. First, and I know it's hard, but try to stay calm.
Easier said than done sometimes.
For sure. But when you talk to the triage nurse or other staff, giving really clear, accurate information about the symptoms, when they started, any medical history, that helps them enormously to make the right assessment quickly.
So being prepared helps.
Definitely.
Yeah.
If you can, bring any medical records you have, a list of medications you're taking, any allergies. It just saves time and prevents potential errors.
Okay. And dealing with the wait itself.
Right, the waiting. That's often the toughest part. But reminding yourself why the waits happen, that it's based on medical urgency, not arrival time, can help manage that frustration.
Can you ask how long it might be?
Absolutely. It's perfectly okay and actually encouraged to politely ask a staff member for an update. Any idea how much longer the wait might be for an initial evaluation? Just be polite about it.
What about things you shouldn't do? Any common pitfalls?
Yeah, a few things to avoid. Definitely don't panic just because someone who arrived after you gets called back first. Remember, that's probably the triage system working correctly for a more critical patient.
Right. Resist the urge to compare.
Exactly. Also, try not to exaggerate symptoms, thinking it will get you seen faster. It can actually mislead the staff and might delay the right kind of care.
Good point.
And try not to crowd around the triage desk or the treatment areas. Give the staff space to work, and please try not to argue with them. They're following protocols designed to keep everyone safe and manage the flow as best they can.
Okay, but what if things genuinely seem to be getting worse while waiting? That feels like a time you should speak up.
Absolutely, 100%. And this is a really critical point the sources make. If you notice the patient's condition changing, if they seem to be deteriorating, you must let the staff know immediately.
How should you do that?
Calmly, but firmly.
Uh-huh.
Go to the triage desk or flag down a staff member. Clearly explain the changes you're seeing, and specifically ask for the patient to be reassessed because their condition has changed.
So asking for a reassessment is okay.
It's more than okay. The sources emphasize it's your right as a patient or caregiver to request a reevaluation if you genuinely believe the situation has worsened. Don't hesitate if you're concerned.
That's actually really empowering, knowing you can and should advocate like that within the system.
It really is. It shifts the feeling from just being passively stuck in a system to knowing how you can actively and responsibly interact with it for the best care.
So wrapping this up then, What we've learned today is that the waiting, the sometimes confusing order of things in an ER, it's not just chaos.
Right. It's driven by triage.
Unnecessary system, focused on prioritizing care based on how sick or injured someone is. And the fundamental goal is saving the most lives.
Exactly. Understanding that process, the quick assessment, the priority levels like red, yellow, green, even black, it helps make sense of why some people get seen before others, totally separate from when they arrived.
And this system doesn't exist in a vacuum. It's supported by bigger quality standards and relies on the hospital having its act together operationally.
Staffing, infrastructure, protocols, all that background stuff matters.
And finally, knowing how triage works, what you can do, like providing clear info, being patient but asking for updates, and especially knowing when and how to ask for reassessment, that can really help manage your own stress and expectations.
Yeah, hopefully it gives you a clearer picture, maybe a bit more calm. If you ever need emergency care, it helps you cooperate with the system and advocate effectively when you need to.
Definitely. So to leave you with a final thought to mull over, think about the immense pressure on those medical professionals doing triage. They're constantly making these incredibly difficult ethical judgments, balancing limited resources like time and beds against urgent competing needs.
Yeah, it's a heavy responsibility.
How does that core mission, saving the most lives possible, shape every single decision they make in that intense environment? And maybe more personally, how does understanding that profound challenge shape how we see our own role and how we act when we become part of that critical system?
It's a deep question, something to definitely reflect on.
Thanks for joining us for this deep dive into emergency unit priority.